Welcome and thank you for joining us. You're listening to the Beyond 50 radio program. I'm Daniel Davis. As many of us approach midlife, we find that we get aches and pains sometimes from directions we never could have even imagined. You think to yourself, boy, I feel sore. What did I just do? Well, I woke up from a nap. And certainly plenty of us have had back pain, probably more often than we've wanted to, and trying to find ways to alleviate that as well. On the program today, our guest has had more than 40 years of experience to work to make the pain go away for more than thousands of people suffering from such things as chronic pain, especially back pain. Throughout his time as a physician, he has worked out how to relieve and eradicate pain in his patients, and now he's decided to put these techniques in a book titled Banish Your Back Pain. I'd like to welcome to the Beyond 50 radio program today our guest, Dr. William Maitland. Dr. Maitland, how are you today?
Oh, very well, thank you.
Are you feeling pain-free?
Sorry, what's that?
Are you feeling pain-free today?
I'm pain-free today, Daniel. Done running around, yes. 6 o'clock in the morning here in Australia.
6 o'clock in the morning, that's awfully early. Tell us how you got started in this field of expertise of helping people eradicate pain.
Well, I suppose it's been a sort of a general build-up over about 45 years. So when I was a student, someone showed me how to inject a buttock. In the army, I was in the army, and the soldier had a painful buttock, and this doctor showed me how to inject it and make his pain go away, and that thought, okay. But I put that away in my memory bank for a little while, and then I became a doctor and a general practitioner, and I thought, okay, after about 10 years, I realized that I wasn't very satisfied with what I was doing. I couldn't heal anything. I just give pills and diagnose, and I wasn't very clever. I wasn't a healer. I wanted to be a healer since I was about 3 years old. And so I started looking at a few alternative things. First of all, I looked at acupuncture, and that worked a little bit. But then, over the years, I've also been experimenting with different pain areas, injecting little bits and pieces and seeing the results of the injections. And over a period of time, I managed to put a lot of knowledge together. And then in 2000, I decided to give up general practice and go and work full-time as a pain doctor, pain specialist, if you like. And I've gradually learnt, doubled my knowledge, I guess, since 2000. And now I know the whole body, and I can move any sort of pain in the body. I can fix chronic backs in 2 weeks. I can fix necks, shoulders, knees, anything that presents, which is not internal, which is external, which is musculo-skeletal. And I have a method of removing the pain from people. And I have a huge practice. I see about 40 people a week, every week, and they come from miles and miles from other countries, from all over Australia, which is 3,000 and 5,000 kilometres away from the most distant parts, and they come from everywhere. So, and with great results, get 95% success rate. So it's really amazing.
Now, you focus on the physical treatment of the condition, which is trigger point injection and Bowen therapy. What exactly is Bowen therapy?
Bowen therapy is a hands-on procedure which is powerful, which somehow creates a vibration in the body and somehow causes healing. Goodness knows how. No one really knows how. But it releases frozen shoulders, it releases very stiff necks, it removes pain almost immediately many times. It's not powerful enough to fix chronic backs and things like that, but it also it loosens up the body, and that's very useful where upper back, where an adjustment is required, and it's a very powerful procedure.
Mm-hmm.
It's hands-on.
Now, you say that more than 90% of the injuries, or, the pain that people suffer from, are from soft tissue injuries versus the regular thinking, which is spinal in origin. Tell us about that.
That is right. If a patient goes to a normal general practitioner, the practitioner will send the patient for an X-ray of the spine. So, all right, we'll talk about lower back pain. Someone has a lower back pain, they go along to the general practitioner, and the practitioner will send the patient immediately for an X-ray and then to physio. They will see a little bit of abnormality in the spine and the spinal X-ray, and they will say that is the cause of your pain. The patient will probably be referred to an orthopedic surgeon, and the orthopedic surgeon will probably not examine the patient, will look at the X-ray and say, yes, that's where your problem is. You either do or you don't need an operation, and that's where it goes. Now, what I have found out over the years is that probably 1% or 2% is spinal. The rest is soft tissue, down near the buttocks and the sacroiliac joint, in all the different areas of the buttock and the ribs, of course, and around the pelvis and all those areas which are that they're all treatable, and it's a matter of diagnosing where the pain is and then fixing it with an injection. Yes.
Mm-hmm. Now, it's really fascinating to think about, all the muscles and the tendons and just all the things that make up the body outside of the skeleton. When you say that it's mostly soft tissue, that really makes a heck of a lot of sense.
Well, it's very, very important to know this too. Mm-hmm. Yes, it does make sense.
Mm-hmm. Mm-hmm. Now, I know that you also treat a lot of people who have chronic lower back pain. What do you think has been the general cause of someone having something like this?
What I've found is that they've had an accident. They either fell off their horse when they were a teenager, they've had a football injury, they've had a car accident, they've fallen off a roof. One man the other day, he'd fallen off, in 1954, he fell off a roof. And I saw him about 5 weeks ago. He came up in a train to see me from Brisbane. It took him a couple of hours. And he finally got there, and I had a look at him, found he had a soft tissue problem. I injected the areas. He came back the next week pain-free. And he was absolutely amazed and so happy, and he gave me presents and lovely photographs and books and all sorts of things. He did. He poured stuff at me. And the third time I saw him, he was pain-free. Now he likes to come periodically just to say hello. Mm. It's really good.
I'm curious. You must have a lot of people that have come to know about you who have tried other things and it just didn't work. And then you come along and you take care of business. It probably seems relatively simple, and I don't know what the experience in your clinic would be like. But what is that experience like for people who come to see you, who have tried a lot of other things and sort of maybe have a little skepticism on their face?
Well, that is right. They walk in and I say, where is your pain? And they say, I have pain down here, and they point to their lower back. And I say, yes, how long have you had it? I've had it for years. Now, that tells me what it is, simply. That, amazingly enough, that tells me what it is. That is a sacroiliac joint pain where they've had a fall in the past. They've got a chronic injury, which is a life sentence. I say to them, I know what's wrong with you. And they look at me and say, I'm mad. How can you know? I haven't said anything yet. You've only said 6 words. And I say, right, let's take you inside and have a look at you. And I press on this, go straight to the point and press on it, bang, like that. Don't feel around it. That is where you're sore, yes. And here, yes. Right, I can fix that with an injection. Do I have your permission? Yes. I inject it. They get up without pain in their back anymore. It's gone. Now that pain comes back after 2 or 3 or 4 days, and then I treat them again at the end of the next week, and they're pain-free forever then, until they re-injure. Mm-hmm. That is amazing. Now, the effect on them varies. Excuse me. It varies because it varies from tears to incredibility to hugs from me, from the women. They just throw their arms around me and say, I can't believe this. And then they remember one man, he came in, fixed his back up. He said, can you fix feet too? And I said, fixed his foot up, and he got up and he had tears running down his face. That's right. Other people come in and they say, you've got 3 months. I'm going to kill myself. In 3 months' time, I've had this. And I fix them up. They don't kill themselves. So I save lives as well doing this. Pretty serious.
Now, you have a pretty high success rate at about 95% with a lot of people as far as eradicating pain and injuries.
I do. 95% is roughly the right amount. I see 35 people today say they all walk out improved or better. Every single one. Well, okay. There's 5%, but very rarely do I get one that doesn't improve or get better.
Mm-hmm. Now, your book is Banish Your Back Pain. What can people expect when they get this book about perhaps there are these ways they can go about doing this on their own?
Yes. The book is written with the idea of talking to the lay public, the people with back pain, and also with the idea of talking to the general practitioners who are visited by these people. The idea, the lay person can read it and have a look and say, well, that's what I think is wrong with me. And then he takes it to his doctor, and the doctor, it's all written in there in great detail on how to treat it. So it's written for the doctor and it's written for the lay person. And I'm trying to get the word out because I'm 80 years old now. Mm-hmm. And I'm going to work for another 10 years, I hope. But I don't want to die and leave this all behind and have someone another 100 years back stumble on all this stuff I've stumbled on. I want to get the word out there. That's my duty too. So my book is full of very, very detailed information, and it's got all my knowledge in it.
Mm-hmm. You know, when you look up, for instance, Banish Your Back Pain, one of the first websites that pops up is from a laser institute. Apparently they go about treating people using laser, I wouldn't know if it's surgery, but at least laser treatment. What are your thoughts about something like that?
I don't think it works terribly well.
And it can be pretty spendy, I would guess, just throwing a laser in there.
It can be expensive, can't it? Mm-hmm. What you said?
Yes, that's what I was saying. It sounds like it would also be something that would be expensive, and you said it doesn't really work very well. So
I haven't had any experience with the lasers, but well, the ones I've seen, it hasn't worked much. People have said I've had laser and didn't do much. So my experience is that it doesn't do much at all. You're not going to get much of it. A very high percentage of success rate with laser. Mm-hmm. There's a lot of books out there on back pain, but they're all right. Yes. But I haven't read a lot of them. In my experience, nothing has helped these people, these hundreds and thousands of people I have seen over the last 12, 14 years. Very little has helped them until the injections have helped them.
Mm-hmm. And what exactly is in the injections themselves, or is there anything?
Right. I have a very dilute solution of steroid. Betamethasone, or is the proper name for it, or defamedrol, celestone conidase, the two trade names. I dilute that in saline and local anesthetic to make a 1 in 22 solution. It's a very, very dilute. Now that 1 in 22 solution is enough steroid to create a healing, to create loss. They get up without pain because of local anesthetics in the solution. The steroid's enough there to create a healing environment and cause the torn pieces to mend somehow. And then the steroid leaves the body in 30 days and is no longer there, but it's done its job. Mm-hmm. So it's really, really a good drug.
Mm-hmm. Fascinating to realize that you can do this, and it just almost seems too easy at times. But it seems like the easiest solutions are always the best ones.
Yeah, true. A lot of people are using sugar, but I don't know much about that. That's another procedure. Mm-hmm. I get them from those patients, the doctors that use the sugar solution. I get them in my surgery when it hasn't worked, and my solution works for them. But it is easy because, you know, what's happened over the years is it's becoming easier and easier to diagnose because common things are common. And if they've had it years equals that sacroiliac joint, then there are 3 levels there. There's the joint, and there's one above it, which I call above the tubercle, above the back of the pelvis, which creates, you've got the back of the pelvic comes back at the back, and comes to a point, and that it's a little bump. They'll call that, that's called the posterior iliac spine, and I call that the tubercles. Now there's an area above that, and there's an area below that, which is a very common point of pain for people, and it's easy to inject, and when they get up, the pain is gone. The pain from that area radiates to certain areas, like to the side of the hip and to the groin. I know that if it goes there, then I know that confirms, well, it supports the diagnosis of say below the tubercle, and then I go and have a look at them on the couch and press on there, and that's where it is, and then I fix it, then I inject it, in the way I do, and then they get up and there's no pain there anymore.
Mm-hmm.
The only reason why they'd have more pain still is if there's another injury in the area somewhere. Mm. So this is how it works. It becomes very, very easy really to do, because I'm doing it full time now, many years, and I know the body thoroughly, and I can put my hand straight onto points where the pain is and can fix it. And when you read my book, you'll be able to do the same.
Mm-hmm. Now, I'm curious, it's really interesting when it comes to back pain where you get people who actually go in for surgery because they've tried so many things. And for me, just the idea of surgery on the back is just scary by itself. You just never know how that's going to turn out. But do you think a lot of these people who go for surgery really don't need to go through this procedure?
That is very, very true.
Mm-hmm.
So many people go to surgery and they know better. Now, I don't see the ones that go to surgery and get better. I don't see them. There's no need for them to come to see me. So there's lots and lots of those. But there are many, many others who have surgery which doesn't work. And these are the ones who shouldn't have really had a surgery, and a bad diagnosis. Wrong diagnosis. It seems that the specialists have very little knowledge of this soft tissue stuff that I'm talking about. They go for the spine every time, and they operate, or they don't operate. They say, I can't operate on you, you're stuck with that, you have to live with it. So many people have a surgical operation, and there's no change in their situation whatsoever. And as you say, it's scary. They can become paraplegics, I suppose. I've never seen that, but I guess they could. That's on the cards. But I think the surgery's so good and they're so skilled, it doesn't happen. Mm-hmm. Very rarely. So scary, yes, but actually, yes, but in the right hands, it's safe. Mm-hmm. But it doesn't work a lot of the times, and a lot of the times they don't need it, as you say.
Mm-hmm. Now, have you worked with children during your practice? Because I was just thinking about a doctor I had read about years ago, and he really liked to specialize in what was known as birth trauma. Apparently, the experience of natural childbirth can kind of throw things off a little bit, like the skull and all that. But as the babies were born, he would actually take, realizing that they're kind of like sponges at this point, and so he could kind of correct the skeletal system if needed be, and the same thing with the skull as well, because he says this is a way that you have to prevent, long-term effects from not making these corrections. And I found that, a pretty interesting point of view in this whole thing. Have you worked with children as a result of something like this?
Yeah, there's two things I can say about that. First of all, the Bowen people, Bowen therapists, the ones who taught at Tom Bowen in South of Australia here, he invented it somehow, and he had two students who are Ozzy and Elaine Wrench, which I probably shouldn't mention names, however, too late, who have put it around the world, and they like to get a baby when it's born and do a Bowen movement on it to help it with its diaphragm, its breathing, and its back, and so on like that, and just make sure it's nicely aligned. Now, that's one. You asked if I've worked with children. The only thing I've done with children is Bowen therapy, which helps them with their lower back pain, upper back pain, which I do quite a bit. They respond very, very well. Their brains are very, very simple and uncomplicated. And the Bowen, because of that, the Bowen works very, very well on children, and it takes away. Lately, I've had some people with children with upper back pain and neck and shoulder pain, and after 2 treatments or even one, they walk up saying they're okay. They've got no pain. I had one little girl. She was 6, and she said, "They all call me Bill. Bill, why haven't I got any pain anymore?" She said to me after my Bowen therapy. Now, but there are 2 others I want to talk about. One is a 15-year-old girl who came in with terrible pain in her lower abdomen and down below her ribs in the front and in her abdomen, upper abdomen and lower abdomen. She was 15. She'd been going since she was 12 to doctors, and they couldn't work out what was wrong with her. The next step was going to be hysterectomy. Now, that's tragic. Hysterectomy at 15-year-old in case it's the cause of the pain. In 2 weeks, I had her better because what she had was a muscle pain deep to the pelvis in the lower back, and she had muscle pain deep to the ribs on the upper abdomen, lower abdomen and upper abdomen. I injected these areas, and after 2 weeks, she was pain-free. She was better. I saved her having an operation hysterectomy. There was another little girl of 9, and she came in and she had this chronic back pain. And I said to the mother, look, she needs an injection, but she's 9. I don't want to do it. The little girl looked up at me and she said, please, doctor, would you do it? I'm sick of this pain. I've had it since I was 5 years old when I fell off the monkey bars. So I looked at the mother and she said, yes, please. So I did a proper dose and everything else. And I did it, and she was, in 2 weeks, she was pain-free. She's running around normal little girl now, running around like a 2-year-old, like a proper 9-year-old. And this, yes, it works on children too, but I hesitate, but I need full permission, and I think about it. And anyway, yes, I do work with children, and it still works with them too.
Now, is there a website people can find out more about your work and how they can get a hold of the book?
Yeah, you can go to Amazon.com.
Amazon.com, okay.
And you can go to Lulu.com. LULU.com is my publisher. And go to bookshop in there to get them in there too. A bit slack, I suppose. I haven't got a website. I should have one, I suppose. Anyway, if you go WilliamMaitland.info, you'll get that from Stanton's Who's Who. Stanford's Who's Who have given me a big write-up. Mm-hmm. And Continental Who's Who as well.
And the book is Banish Your Back Pain. Our guest today, Dr. William Maitland. Thank you so much for joining us here on the program today. It's been a real pleasure.
Thank you. My pleasure. My pleasure.
So if you want to relieve your back pain, that's how you can find out. Visit Amazon.com and get Banish Your Back Pain, and you can find out more how to do that. You can also visit us at Beyond 50 Radio. That's the number 50, beyond50radio.com to find out more. I'm Daniel Davis. Thank you for joining us. This is the Beyond 50 Radio program, and remember, live your day past halfway.